Good afternoon. I'm here in Edmonton. I'll be joined by Minister Shandro and MLA Richard Godfrey in Calgary to make an important announcement about additional support to care for the most vulnerable Albertans, particularly seniors in continuing care facilities. One of the greatest tragedies of COVID-19 has been the devastating impact it's had on many seniors, especially those living in nursing homes or continuing care, long-term care facilities. That has been true both here in Alberta, across Canada, and right around the world. As of today, the average age of someone passing away from COVID-19 in our province has been 82. And more than a quarter of Albertans who are hospitalized with this disease are over the age of 80, while nearly two-thirds of all deaths in our province have been amongst residents of long-term care and supportive living homes. Since last spring, Alberta's government has worked hard to do whatever we can to protect these residents. When the virus first arrived, we put strong protocols in place to protect residents of long-term care facilities, covering everything from visitation policies to mandatory operational and outbreak protocols that all facilities must follow to this day. These strong actions have helped to protect everyone involved, but they've also hit these facilities hard. For 11 months, the operators of these nursing homes and similar places for congregate care for seniors, well, they've worked diligently, adapting to rapidly changing circumstances while they continue to care for elderly or vulnerable residents and others in need. To help, last spring, Alberta's government started providing over $7 million every month to contracted continuing care operators. This was to increase healthcare aid staffing levels and top up the aides' wages by $2 per hour. This funding is part of the more than $260 million that we've invested to support the safety of residents and staff at long-term care, designated supportive living facilities, and at seniors' lodges. This funding has helped protect the health and well-being of thousands of residents across the province. Now, I know that this has gone on for so long that, and thanks to vaccines, we're hopefully seeing the light at the end of the tunnel, but our fight is far from over. With contagious new variants emerging around the world, including here in Canada, we must do more to protect those in continuing care and other facilities and for individuals who receive home care. And so that is why today I'm announcing another important step to help protect our most vulnerable Albertans from COVID-19 with an additional $68.5 million package of support for seniors living in congregate care, in addition to the $260 million investment already made by Alberta's government. This will be provided to operators across the province to help protect Albertans and staff who work in continuing care, providing services, as well as residential and mental health treatment facilities. This one-time funding will help cover the costs that operators have faced as they've worked to protect vulnerable Albertans. This includes additional cleaning, personal protective equipment and related supplies, and increased staffing levels. Every part of Alberta will benefit from this funding. Roughly $48 million will go towards helping more than 500 non-contracted licensed supportive living facilities cover costs associated with operating about 20,000 units. And just to put it in clear terms, those non-contracted facilities are not the ones funded by the Government of Alberta, but they have had to bear significant costs. And I want to thank all of them for their care, compassion, and responsibility over the past 10 very difficult months. We also know that home care services remain vital during this time as Albertans continue to require health and personal care services to support them in order to be able to remain at home in their community. And that's why we are providing nearly $10 million for all home care providers that will help them pay for additional cleaning supplies, again, personal protective equipment, and other related costs. An additional $1 million will go to residential community hospices to help protect the clients that they care for every day in every region of the province. Again, those hospices have had to take greater care and assume additional costs throughout the pandemic. We know it's not just continuing care facilities that need support, and that's why we're providing another $10 million to help residential addiction and mental health facilities cover the increased costs and lost revenue that they have encountered during the pandemic. It's critical that these services continue to be available to Albertans who need them. In addition to huge increases in the number of people whose mental health is negatively impacted by COVID-19, Alberta is also experiencing, as we know, high rates of opioid overdose deaths. Operators at our addiction and mental health facilities have worked incredibly hard over the past 10 months to protect Albertans, and this additional funding will help them continue this important work in the weeks and months ahead to provide those treatment and mental health services in a way that is COVID safe. Let me say thank you to our frontline staff in the nursing homes, continuing care, seniors lodges, mental health facilities, and drug addiction residential programs, all of those and others, home care workers who have shown such great compassion throughout the pandemic. We expect to be able to announce additional supports directly for them in the near future. We should all be proud of what Alberta has achieved these last few weeks and months. Thanks to the sacrifice of so many, we have seen cases, hospitalizations, and the number of COVID-related fatalities decline significantly over recent weeks. We have made gains, and we cannot lose sight of that. But as we begin to ease restrictions, moving to phase 1 in the plan we announced last week, starting this coming Monday, we must remain vigilant. Today's announcement is part of that work. We're not letting up, and we're not letting our guard down. We'll keep fighting for those who are most vulnerable to COVID, and we'll keep increasing the protections for those who work with them. Thank you, and I'll now invite Minister Shandro down in Calgary to provide more details on today's announcement.
Thank you, Premier, and good afternoon, everyone. As Premier said, we are committed to protecting vulnerable Albertans from COVID-19, and our government has implemented proven measures to protect residents in continuing care settings and individuals in residential addiction and mental health facilities throughout the COVID-19 pandemic. Updated operational and outbreak standards are keeping seniors and other folks who are vulnerable living and working in these settings as safe as possible. And this includes screening workers, visitors restrictions, aggressive testing for outbreaks, and mandatory masks at all times when staff are providing direct patient care or working in patient care areas. And these are important steps, but they have increased the costs that operators face. And it's important that every organization has the supports that they need to deliver the care that Albertans deserve. So much has changed for Albertans living in continuing care since the pandemic began. Just one small example, recently, staff at a retirement residence in Edmonton were asking a resident some routine screening questions. And the resident mentioned that some family members whom he'd seen the week before were now feeling ill and being tested for COVID-19. Now, staff made sure that the resident was immediately isolated. They arranged for a test, and that test actually ended up being positive. The entire residence was put on quarantine, and all outbreak measures were put in place, and thankfully no additional cases were identified in that residence as a result of that quick and important work that was done by the staff. Now, the operator incurred high costs for extra PPE and extra staffing to complete the tasks that are associated with quarantine and outbreak measures, completing meal deliveries to individual resident suites, enhancing cleaning and heightened screening throughout the residence. But these efforts, these costs also averted a crisis for residents, their families, and the staff. Measures to protect residents and staff from COVID-19 have profoundly changed the way that individuals live their lives and how the operators support their safety. There's a whole new set of routine practices for staff to follow, and they're doing a great job under extraordinary stress. But we need to recognize that it's an added burden on them as well as an added burden on their residents. Restrictions on outings and visits are crucial to protect residents, but they also add to isolation, and they have a cost for mental health and for well-being. The pandemic has also brought worries and stress for residents that they never anticipated. And we've heard from providers that residents are worried about their accommodation not being able to survive financially or needing to raise rates to remain viable as a result of these increased costs to respond to the pandemic. And they fear that they may have to move because of added costs that they may have to pay. No continuing care resident should worry that they will have to use their retirement savings to support additional costs associated with the pandemic. And I want to assure these Albertans that we'll continue to protect them and we'll continue to do what we can to ease this burden. And that's why, as Premier said, we are providing $68.5 million to protect residents, clients, and staff in continuing care services, as well as in residential addiction and mental health treatment facilities. Now, this one-time lump sum payment will help hundreds of operators across the province. It'll also help protect thousands of residents, as well as clients and staff. More than $48 million will go to non-contracted, licensed, supportive living operators. There are over 500 of these facilities, and they have more than 20,000 units across the province. Now, this $48 million will help operators pay for more PPE, more cleaning, more staffing, and other costs that they face every day. Now, the next block of funding will increase supports for the home care sector, both those who are contracted by AHS to deliver personal care, as well as the non-contracted providers who provide a range of services depending on the needs of the clients. Home care providers have not received support under any previously announced funding initiatives, and we've heard these operators are also facing added costs due to enhanced cleaning protocols, as well as additional staff time that's involved in following the measures. And we understand how important it is to support people to stay home during the pandemic. And so that's why we're providing for these operators $9.6 million to help home care providers deliver the care as safely as possible during this pandemic. We're also providing $1 million to contracted and non-contracted residential, community, palliative, and hospice operators in the province. And this funding will support them with increased PPE, cleaning, and as well as increased staffing costs. And I sincerely hope that this funding will help ease the strain on continuing care operators and to provide confidence to the increasing number of Albertans waiting for facility-based continuing care, and to Indigenous communities that have identified the need for culturally appropriate continuing care services that are closer to home. To all of these service providers, and as well to their residents and their clients, we've heard your concerns and we are responding. We're also restoring the Affordable Supportive Living Initiative, or ASLI. We use the acronym, pronounce it ASLI, to build more continuing care facilities faster and more cost effectively. Now, Alberta seniors and vulnerable adults deserve to live in the communities that they call home, close to family, close to friends, and they deserve to feel safe in these facilities despite the pandemic. And last, as Premier noted, we are providing a one-time payment to support the operators of residential addiction and mental health facilities across the province. Now, they too have faced increased costs to care for clients while dealing with reduced occupancy limits to ensure physical distancing throughout each of these facilities. And so that's why we're providing $5.3 million to help cover these facilities with their increased costs, and another $4.6 million to cover their unusable beds during the pandemic. Now, it's critical that residential addiction and mental health treatment spaces continue to be available to Albertans who need these services. Due to physical distancing and isolation requirements, many beds are not able to be used, and these facilities rely on this income to cover many important services. I would now like to invite my colleague, Richard Gottfried, who's the MLA for Calgary Fish Creek, to the podium. I've been fortunate to work closely with Richard as he leads an advisory panel to review facility-based continuing care throughout the province, as well as Alberta's continuing care legislation. A reminder that I think we have 3 different pieces of legislation. It's 6 regs, 6 different types of standards of practice, or standards of care, standards of practice, and the work that his panel is doing to review that legislation, as well as the facility-based continuing care system, is incredibly important work. And this work is part of our commitment to learn from the pandemic and making continuing care safer, while we address the ongoing challenge of improving access for Albertans. So Richard, I'm very grateful for your advice and for your continued support, and so thank you very much.
Thank you, Minister. Good afternoon, everyone, and I'm pleased to be here to support this important announcement. I'd like to add my thanks to the premiers and to the ministers, and on behalf of all Albertans, to the residents, to the operators, to the staff, and to the family members that we're speaking about today, the valued seniors in this province. As a chair of the Continuing Care Review Advisory Panel, I'm very familiar with the work of the continuing care operators in this province and home care providers to comply with public health guidance. These operators provide the health supports, personal care, and accommodation services for vulnerable Albertans that is much needed in our great province. And keeping individuals safe has been a top priority for them and the government. Let's be clear, the added costs operators have had to absorb until now are not for extras. These were to keep providing essential services during the pandemic and to keep residents safe. For example, more PPEs had to be purchased and changed more frequently to prevent possible transmission between individuals. These operators have had to hire more staff to keep supporting residents when requirements came in to screen all staff and visitors, significantly enhance cleaning, and adapt almost every part of daily life in their centres to keep people safe. All these changes were essential, necessary, and much needed in protection of our valued seniors. But I've heard how tough it's been, and I now know how welcome it is to have today's news in support of the sector and our valued seniors. This is needed funding, tailored to address the particular costs that have been incurred by specific operators and providers across the province. It will provide relief so operators can concentrate on what they do best, caring for those most at risk during these difficult times. And together, we will keep everyone as safe as possible going forward during challenging times ahead. Thank you, and I'd now like to invite Kim O'Brien, President and CEO of United Active Living, who also has a facility in Calgary Fish Creek, my own home constituency, to say a few words on behalf of her residents and her team. Thank you.
Thank you very much for the invitation to be with you today for this important announcement. And thank you to Premier Kenny, Minister Shandro, MLA Gottfried, and those within the government of Alberta and our sector, including industry associations such as ASHA, who've worked so hard towards this important announcement today. This funding not only provides welcome financial support, but it recognizes the actions taken by all licensed supported living providers and home care providers to care for and support older Albertans throughout this pandemic, as well as organizations who serve other vulnerable Albertans included in today's announcement. Since the start of the pandemic, All across the province, groups like us at United Active Living have taken necessary and extraordinary measures with one single focus: the safety and well-being of our residents and our employees. This announcement today recognizes the importance of this ongoing work. We also see this announcement, though, as a positive step forward in building a stronger and more coordinated and more inclusive continuing care sector in Alberta. One that is united in our collective focus of serving all older Albertans now and into the future. On behalf of all of us at United Active Living and our colleagues across the sector, we thank you again, and we look forward to working with you in service to all older Albertans. Thank you.
Okay, so now we're going to go to the phones for questions. If you can just limit yourself to one question, we will get through as many as we can. Operator, can you please put through the first caller?
Jesse Weisner, Global. Well, hi, this question is for the Premier. The number of variant cases has been rising in the province, and there's unknown community spread. How confident are you that the February 8th reopening will go ahead, and what would need to happen for it to be postponed? And if it is going ahead, how do you assure businesses and the public that Alberta won't have to close down again in a few weeks if variant cases climb and community spread becomes prevalent?
Sure. A couple of things. First of all, as Dr. Hinshaw said at her briefing yesterday, Alberta has the best and the most aggressive testing regime for genome sequencing to identify these new variants. And we've also massively expanded our contact tracing system, so we're able to get on top of cases like this much more quickly. Secondly, I think the new federal travel guidelines and restrictions with respect to pre-testing, testing upon arrival, and the enhanced quarantine measures should all help to reduce the future introduction of these viral variants into Alberta. Thirdly, while we are right to be concerned about these variants, we did lay out last week a very careful, gradual, and prudent path to reopening some aspects of economic and social activity as we seek in a balanced way to protect lives and livelihoods. As we said, the key triggers will be based on hospitalizations, recognizing that at the heart of our effort against COVID-19 is controlling the spread so it doesn't overwhelm our hospitals. The first measure, of course, was reopening schools on January the 7th, and then the second measure was related to personal services about 3 weeks ago. The third measure, the third step would involve a limited allowance for dine-in service for family cohorts, as well as personal training at gyms and fitness facilities, and the resumption of sports and other physical activities that are related to schools. So those are very limited activities. For example, this is not going back to normal for the restaurants, but rather only allowing a family cohort to come in, or an individual and their two close designated contacts, tables that are 2 meters removed from one another, with contact lists that are maintained, alcohol service that ends at 10, restaurants that have to close at 11, and all of the other COVID-safe measures in place. And we're talking in the fitness facilities about low-impact personal training, where the people would be distanced, wearing masks, and following all of those measures as well. So these are very limited, almost baby steps towards reopening. But we need to recognize that we can't suspend businesses indefinitely, because many of them simply won't survive that. And the consequences there to people's health, their mental health, their emotional health, would also be devastating. So we're trying to balance these factors. But as we've said, if we see we go back into significant viral spread and growth across the province, then we may have to tighten measures again. I know no one wants to be on the roller coaster, but we cannot guarantee people that there won't be a change of policy in the future. We don't want there to be, But what we've heard from these small business owners is they'd rather have an opportunity to operate for a period of time now while our numbers are coming down and the pressure is being relieved from the hospitals. And if necessary, in the future, should we see exponential growth, we'll have to act accordingly. So it's the gradual, prudent, careful path. This is based on the public health advice that we've received. Let me point out to you that our two neighboring provinces, BC and Saskatchewan, have maintained limited dine-in service at restaurants all through the fall and winter. They've had lower levels of spread, and they're also facing the challenge of the new variants. So we're not actually getting ahead of our peer provinces, and we're taking a very careful approach. We'll monitor the numbers very closely.
Operator, can you please put through the next caller?
Dean Bennett, Canadian Press.
Hi, Premier. I just want to talk to you about enforcement policy. Last week, you chided Alberta restaurants for opening illegally, and then you opened them. You also say you can't intervene to stop the weekly 300-person super spreader event at Grace Light. Well, that's fair enough. But your government set policy direction on enforcement, and as you try to balance lives and livelihoods, when it comes to serious clampdown enforcement of COVID health laws on businesses and organizations, frankly, it's starting to look like it's just a bluff. Beyond mild fines and scoldings, it appears there won't be crippling penalties or enforced closure for even the most flagrant of violators, i.e. Grace Light. Isn't that a risky strategy, given other groups may decide to go their own way if word gets out that Alberta's carrot and stick approach really has no stick?
Well, first of all, are you still there, Dean?
Here, Premier.
I'm sorry, I didn't hear you talked about a 300-person super spreader event. I didn't quite understand the context of that.
Well, you spoke about that on Ched this morning, the Grace Life Church.
Oh, okay. Yeah, so let me answer by saying that, as you know, Dean, it is not the responsibility of elected political leaders to enforce the law. That's the responsibility of enforcement agencies. And there are a number of them who are have designated powers under the Public Health Act to enforce public health orders. That includes peace officers, the Edmonton and Calgary Police, for example, the RCMP in other areas. It involves, in some cases, designated bylaw officers, and in some cases, health inspectors. And we trust them to use their professional judgment in when and how best to enforce the law. My understanding is their general approach when it comes to public health measures is to start with education and then move to compliance to help people be aware of the rules, help them comply with the rules, and if they flagrantly violate the rules, to move to enforcement. And there are fines and other penalties available to them. So I don't want to live in a society where politicians are pointing fingers at who should get penalized and how. That's not how our democratic system works. We have created these public health measures. Some of them are advisory, some of them are mandatory. My point about the handful of restaurants that opened in violation of the public health restrictions is that, you know, they've really, it's irresponsible and unfair because they've created an unlevel playing field. There are 10,000 hospitality businesses in the province, and nearly 10,000 of them have respected the rules. It's unfair that a handful have not done so. It's unfair to all of the rest of them who have made these sacrifices to help us get these numbers down, to reduce the pressure on our healthcare system. With respect to, I gather there's one church that's been identified that has been apparently not respecting the 15% capacity limit that's been imposed. Again, the enforcement is the responsibility of the responsible agencies, but I will say this, that Alberta has made it a point to try to bring in public health measures that save lives, protect our healthcare system, while minimizing the impairment of constitutionally protected rights and freedoms, including the freedom of religion. And I think and I want to thank, again, like I'm sure 99% or more of the places of worship across the province in different faith traditions for having been so careful. They've been able to continue with smaller worship gatherings at 15% or less, following the mandatory masking and the other COVID rules. And so I want to thank them for doing so, for taking that care for their community and their members. I think it's incredibly unfortunate that we have apparently one out of thousands of places of worship that is flagrantly violating the rules. And I think, they don't need to do that. They can gather in congregate worship. They can spread out their gatherings. They can do several worship gatherings. That's what other faith communities are doing. Other faith communities are making sacrifices, and yet they are still able to exercise their constitutionally protected religious freedom. So I'll leave the enforcement to the enforcement agencies, but I think what they're doing is sending a terrible message and is truly irresponsible.
Operator, can you please put through the next caller?
Our next question comes from Rick Bell of the Calgary Sun.
Good afternoon, Premier. In today's newspaper, former Wildrose leader Brian Jean has written a hard-hitting column which, without going into the details, is very critical of your government, the government's attitude, the government's style, some of the decisions you've made, and also saying that Albertans have begun to sour on your government. Mr. Jean is not the only one from the conservative side of the fence who has been critical of your government of late. What do you think of, if you've read the column, of Brian Jean's criticisms or criticisms generally from people who voted for you last time? Do you think these criticisms have any validity?
Well, I haven't seen or read that column, so I can't comment on it, but I'm not surprised that people would be critical of government that has to take really hard decisions at an unprecedented time of crisis like this. As I've said from the beginning, often we are faced not just with bad choices, but sometimes only with terrible choices. I think it's easy to sit on the sidelines and be an armchair quarterback as we make our way through these multiple crises at the same time. The largest public health crisis in a century, the largest global economic collapse in a century, the largest collapse of energy prices in our province's history. All of that on top of 5 tough years that we already went through. So these are incredibly tough challenges for Albertans generally, and yes, for their government. And so often we only have poor choices to make. There is no easy way through this pandemic. There is no easy way through a massive global recession and an unprecedented collapse in energy prices. Frankly, there's only a hard way through it, and there's only tough decisions that we often have to take. It's no secret that I've been, some of the criticism from people who would call themselves on the right is about public health restrictions. And it's no secret that I have spoken about the damaging impact of public health restrictions, which is why we have approached them as a last and limited resort. It's also why we have more consciously than other Canadian governments, sought a minimal impairment of rights while controlling the virus to protect our healthcare system and lives. We've sought that balanced approach of protecting lives and livelihoods through all of this. I'm sure all of us will be able to look back and see how we could have done some of these things differently or better, but I think generally Albertans have risen to the challenge, and we've made the best faith effort with expert advice to strike that balance. But to sit there as some might be doing in an ideological corner and to cast stones at those who are making these incredibly tough decisions right now, I don't think is a helpful contribution to the debate, especially if the criticism is just we're opposed to all of these public health measures. Because if you want to take that position, good on you. But I think you have a responsibility to then take account of the consequences. Rick, if in November into December, the daily number of COVID cases was doubling every 14 days, and our hospitalizations for COVID patients went from about 100 in October, the end of October, to nearly 1,000 at the end of December, tenfold growth. If we had not taken difficult and painful and frankly unpopular measures, that exponential growth clearly would have continued. That means going from 2,000 daily cases to 4,000 to 8,000. It means going from 1,000 people in hospital to 2,000 to 4,000 in hospital. That would blow out the capacity of our hospitals, even though we've essentially provided unlimited resources to the healthcare system to cope with COVID. And it would also mean a massive increase in the death rate in Alberta. You know, if you want to go to the kind of libertarian extreme and go to a ideological sandbox, go visit South Dakota, where they have had effectively no restrictions. And a lot of people applaud that. But guess what? They've had 1,700 COVID deaths with a population of 800,000. That is 5 times higher than Alberta on a per capita basis. And so instead of 1,600 deaths in Alberta, if we had followed the South Dakota path, we would have something in the range of 8,000 deaths. So to folks who are being critical of restrictions, I've always said, you know what? I appreciate that we have a province where there are a lot of people who jealously guard their freedoms and are right to be skeptical about government overreach and these extraordinary measures that we are using. I think that's a healthy instinct. That freedom spirit in Alberta's political culture is a good thing. But it has to be exercised responsibly, and setting up tent hospitals at McMahon Stadium and taking body bags out of those tent hospitals in the middle of February because we completely overwhelmed the healthcare system would not be responsible. So this is a government that is seeking the best way forward, a balanced way, and I just encourage people to be mindful of all the different complex considerations that we have to make with these tough decisions.
All right, we have time for 3 more questions. Operator, can you please put through the next caller?
Lisa Johnson, Edmonton Journal.
Hi, Premier. Thanks for taking my question. I'm wondering if the funding announced today has any effect on the province's ability to take advantage of federal funding, particularly federal funding that is meant for wage top-ups for frontline workers. And if not, why is this government leaving more than $300 million on the table? Is it ideologically opposed to giving a temporary pay raise to frontline workers, or what's the reason behind this?
Answer to the first question is no, it doesn't have an impact on our ability to access that funding. And the answer to the second question is we're not leaving that money on the table. In fact, there is a request for federal approval of our proposed framework for the wage top-up, where Alberta would contribute fully. As you know, we've already accessed a good portion of that, I think in the range of $60 million, but we've made an application to the federal government to proceed with the additional $317 million of funding that is cost shared with the province, 25% from the province. So we've consulted broadly with the concerned sectors to determine the best way of framing this. We've looked closely at what other provinces are doing, and we hope our application will be approved and we'll be able to announce the details in the fairly near future.
Operator, can you please put through the next caller?
Kevin Nimick, CTV.
Hi, Premier. UCP MLA Drew Barnes is calling on you to introduce an independence referendum. Do you support this call to action, and are Barnes's views welcome in your caucus?
The United Conservative Party was created with an agreement that was endorsed by 95% of our membership of the 2 legacy parties. That agreement said in its preamble that the United Conservative Party is committed, is loyal to a united Canada. And that's the basis on which the party I lead was created. That's the basis on which we ran and received over 1 million votes from Albertans. So we received an endorsement with the largest number of votes in Alberta electoral history as a party and a government that would fight for a strong Alberta, fight for a provincial government that jealously protects its rights within the Constitution, that fights for Alberta jobs and for our industries, but within the Canadian Federation. So that is absolutely clearly the position that MLA and all UCP MLAs ran on. That's the commitment they gave to voters. That's the agreement that they endorsed in July of 2017, and that is our position. As I've said before, MLAs have a right to speak their mind, but this government will continue to fight for a strong Alberta within the Canadian Federation.
Operator, can you please put through our last caller?
Audrey Nouveau, Radio Canada.
Hi, Premier. I have a question for you on the variant that has been asked before in English. I'll ask it in French. Monsieur le Premier ministre, est-ce que vous pouvez nous dire si vous trouvez qu'il est encore prudent de commencer le déconfinement lundi prochain alors que le nombre de variants de coronavirus est très élevé en Alberta, plus qu'ailleurs au pays?
Notre niveau de... excusez-moi. Merci de la question. Il faut dire qu'en Alberta, on a un système qui teste ces variants qui est plus rigoureux que dans les autres provinces. Deuxièmement, nous prenons une approche de décontracter les mesures de santé publique de façon très prudente. Et nous prenons les petites étapes. Nous aurons le temps à voir s'ils ont un impact négatif sur la transmission du virus dans la communauté. Évidemment, nous voyons une diminution de transmission des hospitalisations et des morts à cause de COVID-19 et maintenant et depuis quelques semaines. Si nous voyons une augmentation dans la transmission du virus, c'est bien possible qu'il faut changer la direction et mettre en vigueur les nouvelles restrictions. Mais écoutez, ce que nous faisons est très modeste. Par exemple, quant au restaurant, nous prenons effectivement la même politique que la Colombie-Britannique qui ont mis en place les mêmes mesures depuis plusieurs mois. Ils ont un taux d'infection plus bas que celle en Alberta et ils font face également aux mêmes variations du virus. Alors, nous cherchons une approche équilibrée, prudente et selon le meilleur avis que nous avons reçu des experts de santé publique, comme le Dr. Hinshaw, évidemment.
All right, that's all we have time for.
Thank
Have a
you.
good day, everyone.